Hello again. Now, the fight to end malaria in Mozambique continues. The country's health ministry has partnered with two organizations, Vestergaard and Goodbye Malaria, to mark World Malaria Day on Monday. This partnership will be holding a plenary session that will also include the private sector in Maputo. Mozambique is said to be one of 6 countries that account for more than half of malaria cases and deaths globally. Well, for more on this, I'm joined now by Sherwin Charles, the CEO and co-founder of Goodbye Malaria. Sherwin, good afternoon and thank you very much for your time. Is this a significant milestone, this partnership that you're going to be unpacking further on Monday in Maputo between you as Goodbye Malaria, the NGO, the company Vestergaard and the government of Mozambique in the Department of Health?
Hi, thank you very much, Dan. Yeah, on Monday we will announce the continued partnership. It's been in place now for a few years. It is to re-emphasize how important the partnership has been, particularly during the pandemic and during COVID, how important the private sector has been to keep us on track towards malaria elimination in Southern Africa, to celebrate the wins that we've had with the governments of Mozambique, South Africa and Eswatini, but also to ensure that the resources are not diverted from malaria to other emergency needs, but that we stay on track to meet the 2030 SDG goals and the objectives we have for ourselves to eliminate malaria in Southern Africa.
Well, in renewing this partnership, as you'll be announcing on Monday, means that there have been challenges because of the pandemic. What sort of challenges has this partnership faced?
Most importantly, Dan, is getting the messages out to our communities that are affected by malaria to seek access to health. During the pandemic, people have been afraid to go to clinics to ensure that they get treatment. And this is the first message that we want to put out there, is that communities, when there is malaria, people need to go and seek treatment, get tested, and have access to healthcare. The second one is to ensure that the commodities are in place. The pandemic has disrupted global supply chains, has disrupted logistics in the country. So it's very important to ensure that the commodities are at the health centers, that those coming to seek treatment find the treatment there, find the test kits there. Okay. And then the third thing is to ensure continued resource mobilization for malaria in Southern Africa.
Okay, my next question is a little bit long. I apologize to you and our viewers. You've told us before, Sherwin, that you as an NGO, Goodbye Malaria, you promote these innovative partnerships and collaborations, cross-border collaborations with South Africa, Mozambique and Eswatini, for example, and the Global Fund and the private sector in the fight against malaria. Come the pandemic, and there are challenges, maybe there are steps backwards and stuff like that. And Mozambique today, where you're going to be on Monday, still contributes a large chunk of the cases of malaria in Southern Africa, and in terms of people who are infected, but also in terms of people who die. So are you hopeful that that going forward you're going to begin to make even a bigger dent in the battle against malaria in Mozambique in particular?
Absolutely. I have never been more excited than now to know that we can get to malaria elimination in Southern Africa. There's an urgency that wasn't there pre the pandemic. And it's going to be driven by the newfound urgency around data. We can now become more laser focused, both with our intervention and with our resource allocation, because we have better data. One of the things to celebrate in the world of malaria is our data used to be retroactive. We used to get the data for 2020 was received in November of 2021. Today, we're in a position to get real-time data due to the platforms that have been put in place during COVID. And that helps us to make better decisions, more informed decisions, and to be more focused on where we implement the interventions.
Okay. Sherwin, very briefly, we're out of time now. What are you going to tell the Mozambican Health Minister on Monday? What will be the key message to make sure that what the hope you've just expressed becomes a reality?
To continue our efforts, not to divert resources, to put more money into malaria, and to embrace the private sector partnerships that bring innovation and new tools to bear.
Thank you very much, and all the best. Travel safely on Monday to Maputo. That's Sherwin Charles, CEO and co-founder of Goodbye Malaria.